Hello everyone, this is Dr. Shilpa Madhupati, Obstetrician and Gynecologist, Infertility Specialist and Laparoscopic Surgeon in Dr. Shilpa Women's Clinic, Kondapur. Today I would like to discuss about the early pregnancy losses in a pregnant woman. What are early pregnancy losses? Early pregnancy losses in the sense abortion, increased missed abortion or spontaneous abortions in the first 3 months of period, we generally consider it as a early pregnancy losses. So why this happens? Early pregnancy loss is very common for is it common for some people? Ask, is it common for everyone? Why we generally see so many cases of early pregnancy losses? People will ask so many questions regarding the abortions when they face the or when they try to come across by some or other people regarding abortions. When they come for the prenatal counselling, people will ask to avoid what are the things to be done to avoid the abortion rate, and what are the things to be done to avoid, and what are the medication to be needed to to prevent the abortion rate. So I just want to tell you about the abortion in the sense for each and every patient. When can we diagnose, when can treat the patient. So first of all, I would like to give the information regarding why most common causes of the abortions. The most common causes of abortions are generally any sort of infection, whether it is viral or bacterial, and within the blood infection, fever, like fever symptoms, or any urinary tract infections, or any hypothyroidism, like any thyroid disorders, any glucose metabolic disorders, and any clotting factor defects like thrombophilia. So regarding infections, I would like to tell about the most common infections are urinary tract infections. Urinary tract infections will influence the vaginal infections, which ascend into cause the abortion rate, increases the rate of abortion. And detailedly about urinary tract infection, I'll do a video, another video in the next session. So other causes are urinary tract infection is one of the cause, and the second one is hypothyroid disorders. Thyroid disorders in the sense like during a pregnancy status, usually the thyroid hormones will not be similar to the normal person. In a pregnancy status, generally thyroid hormone should be from 1 to 3 milli-international units. So if it is increasing more than 3, we have to start the medication. Whereas in normal persons, the thyroid levels will be cut off for the TSH levels will be 5.5. For them, we don't need to start the medication till that range. But during pregnancy, there is a chance of abortion with the subclinical hypothyroidism. We generally consider it as a subclinical hypothyroidism, where T3 and T4 are normal and TSH is raised. Above 3 also, we generally start the medication that will avoid the abortion rate. And another thing is diabetes. Any raised sugar levels may also cause increase the abortion rate. And another important thing is clotting system mechanism defects, thrombophilia. So bleeding disorders, autoimmune mechanism, when autoimmune diseases, when they generate autoimmune diseases in the sense anti-nuclear antibodies. Some people will have a weak defense mechanism, like auto antibodies will prevent the pregnancy to grow, and that causes missed abortion. That impacts in not forming a cardiac heartbeat in the early stages of the pregnancy. And another factor is thrombophilia. For them, first of all, we'll try to diagnose why the patient may have these sort of abortions, and after coming to know about the abortion status, why the causes, by doing investigations in the early pregnancy, and by doing ultrasonography, and by checking out the blood supply to the baby. After this, we'll diagnose it and we'll give the medication accordingly in view of their status. So among them, blood thinners will also be there. Some people will be worried about blood thinners, but there is no point in worrying about. The thing you should understand why you are taking. That's it. And it is a temporary one. Only during pregnancy status you are going to take the medication. After that, you can stop the medication regarding your thyroid mechanism or any diabetes status, whatever it may be, according to your health status. Most commonly causes of the abortion and the treatment wise. So you better consult the gynecologist prior to having a planning for the pregnancy, or as soon as you attain the pregnancy, to avoid the abortion rate in the first 3 months. Thank you.